Yeah. So once again, I welcome you
Yes.
all to our Ayurveda-IT Consortium against COVID-19 training sessions. Today's topic is clinical experience sharing on the casualties in COVID-19 and its management. And we have with us Dr. Professor Asmita Ashishwari, Head of Department of Shastra and Vaishya Kalpana, Bharati Vidyapith Deemed University, Pune. So before handing over the session to Dr. Ashmita, let me invite our Dr. Naveen sir to just give an introduction. Sir, please.
Thank you, Shruti. Good evening, one and all. Today we have the sixth session, scientific session on the management of COVID-19. We have respected doctors from all over India, from Bangalore, from Pune, from Delhi, and many more states. We have groups of doctors who join our sessions every day. That's a quite exciting thing that we have doctors who are very much looking forward for the things which we are doing as part of AYURVEDA-IT Consortium against COVID-19, which is a philanthropic mission taken forward by volunteers from different parts of India, who are our respected doctors, which includes senior doctors from different parts of India who are having extensive knowledge and practice in COVID-19, to even students, BMS students, final year students who work as our coordinates to work as a link between the patient and the doctor, so that uh, our services from the consultation to the delivery, the doorstep delivery of medicines, everything is carried forward smoothly, without any kind of complaints, with any kind of difficulties for the patient. So, as part of this mission, we have been, as I have mentioned already, um, we have been doing such scientific sessions every day, for which is a platform for sharing experiences, to hear, to listen to different persons, different eminent personalities, practitioners from different parts of India, who are having wonderful experience in the management of COVID-19. So today it's the first sixth session, and we have very senior physician, very senior doctor, Professor Asmita Wele from Pune. She is, as Shruti mentioned, she is the professor and from Rasashastra and Vaishya Kalpana department in Bharati Vidyapith, Pune, deemed university. Madam, we are so much pleased to have you here. We are so much excited to listen from you. I invite Madam, before that, I thank Madam for being in this session, in this platform today for us, for giving lectures to the doctors who are part of Ayurveda-IT Consortium against COVID-19. Thank you, Madam. Over to Madam, please.
Uh, Good evening, everybody. And in the beginning itself, I thank Dr. Ram Manohar first, and then your whole group for inviting me here, and for taking out time at this hour of the day. So just give me 1 minute for the adjustment of the screen, and then I'll start. Okay. For the sake of organizers, I'm just telling that I have also started this on my mobile, because just a moment, I just want to put off the mobile screen. Okay. So, yeah, that's correct. Sometimes it happens that there is no connectivity, and then it is very difficult to understand whether I'm connected with you all or not. So that's why this was the adjustment. So let's begin. And are there any questions? I would like to start with questions, and if nobody has any questions, then I have to start with the presentation.
Yes, definitely, madam. Many of our doctors used to have a lot of questions, but I hope before that, we would like to listen, like to hear from you. Then maybe how it is comfortable for you, we can lead like that. But anyway, if you have like, of course, we know that you have a lot of experiences, which
Yes, if you all are talking about COVID for last 5 meetings and this is the 6th one, then I'm sure you are aware of the basic facts and what's going on there, what is happening, all of that. But then let me take a review and then we will come up. I'll share my screen. So for the presentation, I think I need to, this is the problem with a window. Okay. Can you see my screen?
Yes, ma'am. It's loading.
Okay. That's good. Nice. See, the information which I got from these enthusiastic doctors is I should talk about casualties in COVID and their management. See, I come from Maharashtra. I think all of you are aware. And I do not practice only for COVID. You know, we all practice Ayurveda. We all practice Shuddha Ayurveda or integrative medicine, focusing on Ayurveda, but as and when needed, we do take we do use diagnostic tests, and we do take consultations, or we do discuss our issues with allopathic physicians as well. So from that perspective, if you ask me, I have not practiced in COVID OPD, but yes, I did my term in COVID IPD in our institute. And in our institute, Bharati Vidyapith has been a COVID center, and after the Ayush request, we could also start dedicated COVID center. There was a letter from the ministry and the state government that we should start a COVID dedicated center for rehabilitation, for other treatments, and therefore we did start that, and I did my duty there, and that's where my small little experience comes from. So whatever I'll be talking today is a mix of what we did and what the text says. So this is what I'll be talking with you today. I hope you understand. So let us take a little look at this virus. You know that Corona 2 is, it's called Zoonoses. I'm aware that there are many senior physicians who are aware of all of this, but there are also students, so it can be just a rapid revision for them. So this is, zoonosis means unintended overlap of animal and human virus. So the story is very famous that this virus has come from the bat to the human food, from the bat to the human food, and from there it spread. The family is Coronaviridae. This is a RNA type of virus. There are two types, RNA and DNA. What is RNA type of virus? It means it replicates in cytoplasm. It doesn't go to DNA. It doesn't go to nucleus where DNAs are. So this is the RNA virus. There are 4 types: alpha, beta, gamma, and delta. And SARS-CoV-2 is beta 1 and 2 type of virus. And now there are many variants. Professor Dr. Yogesh Shauche had given a wonderful lecture in last month explaining the variations of viruses, and you can download that lecture from YouTube and you can watch it. Professor Dr. Yogesh Shauche from NCCS Pune. So this SARS-CoV-2 or novel coronavirus, which we know as nCoV-2, causes the disease, which is named COVID-19. And this nomenclature was fixed by World Health Organization in February 2020. So it's over a year that we know this virus. We all are aware about it. Now, for all of us, this is a new disease. what I thought of it, like considering the Ayurveda guidelines, considering the Anukta Vyadhi Nidan Chikitsa, I thought that let us observe, being a Vaidya, I have to observe the clinical symptoms, clinical signs, what's happening. And based on that, if I could reach to some dosha ducha samurchana, nishchay or vinishchay, and then accordingly, if I can treat, it would be the right path. So here you will find that the modern medicine is more of after understanding the virus, its nature, its structure, its pattern, and then creating creating antibody for creating vaccine for it, and that vaccine will generate antibodies. So that approach is different than the Ayurvedic approach. Ayurvedic approach is a strictly functional approach. We look at the Nidan, we look at Lakshan, Purva Roop. I mean, both are together here. And then we come to the Dosha Dusha Samurshana, and then we start selecting our drugs. So here, according to the Ayurvedic analysis, using our matrix, I consider this is a viral infection. That means the hetu is agantuja. Virus is congruent to visha because it's very quick, tivra, ashukari. Its effect is, there is, though the incubation period is longer, its effect is fatal. So this is like a poison, visha. Visha has 10 characteristics which are ojo viparit. So we have to consider that factor when we consider it as agantuja vyadhi. Once it is agantuja vyadhi, we consider, but the first sign symptom is jwar. So this jwar can be of Vishama type. In Charak Samhita and also in Rasa Shastra, we find Bhuta Bhishyanga Sannipat, a very typical category. Short time and fatality are the two cardinal signs of this Bhuta Bhishyanga Sannipat. So this is Tridosha Janya Sannipat. Also, this disease is aupasargik, contagious. It spreads through air. Now, initially it was the droplet theory and there was a distance of 3 feet. Then the distance increased to 6 feet. And now they are saying that it is airborne. So it's aupasargik and it is pandemic, janapadodvamsa. So this is contagious pandemic, not even epidemic. So given this characteristic and the structure of this disease, what I could put forth is here in this schematic diagram in front of you. Please pardon me for this very basic diagram. This is like I have used a chalk and blackboard to make my point clear to you. You can see here virus. Is it visible on the screen? I'm using the mouse.
Yes, ma'am.
Okay. So this is the virus, agantu and extrinsic hetu. It generates the vyadhi, which is Bhuta Bhishyanga Jwara.
Sorry, madam. Sorry for interrupting you. We can't see the cursor of the mouse. Maybe you could select from your presentation a cursor from the left lower side.
Yeah,
that
I
marker.
think
I
can do that. Use a presenter view. Okay. No. Use slideshow. No, I cannot. Okay. Pen. Yeah.
I hope you're seeing that.
Yeah. Now can you see it? No, I can see the marker, but not it. Okay. Laser pointer. Yeah. Can you see it now?
Yes, ma'am.
Yes, ma'am.
Okay. So this is the virus. Then it generates the vyadhi. It gives the first sign symptoms of jwara. Then it spreads. That is its prakop. It happens in pranavasrutas, in the respiratory diseases. And in Charak Chikitsa chapter 3, you will find Vayum Raktam Pradushayan. This Vayu Pradushayates Rakta. And then this starts, its proliferation is quite fast. The dosh involved is first Vata Kapha and then Pitta Vata. That's how I could see the disease, or I could interpret the disease. And it is, of course, the dhatu, main dhatu is Rakta. Raktam Jiva iti sthiti, it moves all over along with Rasa and Rakta. But here I feel that Rakta is the thing because the inflammatory factors, IL-6 and all other things. If I'm putting the two things together, I'm very clear that considering whatever is coming from the unknown side, I'm using it for my understanding of Ayurveda, based on the Ayurvedic philosophy. So through Rakta, it spreads very fast. And this particular stage is the beginning stage. Then if we want to do the staging based on Shatkriya Kal, then the time points for intervention. Shatkriya Kal is what? Kriya Kalam na hapayet. Being Vaidya, we need to treat the dosh in Chayavastha itself. So once the virus enters into the respiratory system, its incubation period starts. That means the Chayavastha starts. And it depends from one day 1 to day 14, depending on the prakriti of the person, depending on the innate immunity of the person. It takes 1 to 14 days. The reports which are coming in from different research papers, generally or maximum people, they suffer in the first 5 to 6 days. At that time point, the virus is very virulent. So in this time point, that is our Chay Prakop Prasar. So this is the preventive window. From day 1 to day 14 is the preventive window, which is the incubation period. After that, it starts showing its sign symptoms, where it is the moment it starts showing its sign symptoms. In some patients, it could be day 2, in some day 5, some day 14. So the moment it starts showing its sign symptoms, it becomes, we have to label it as mild to moderate category, and that's the Vyakti of the disease. So here is the first time point of our treatment. Then, then is the, if we cannot arrest the replication of virus, or if our body cannot fight the virus, then it goes to the moderate level, and that is the Bhedavastha. And later on, so in the mild to moderate, the patient starts mild fever, dry cough, he starts feeling debilitated, and then in the moderate state, there is breathlessness, the oxygen saturation starts coming down. Severe stage is marked by pneumonia and multi-organ failure, leading to fatality. So up till Prakopa point, this disease falls in the category of Agantu, or if you want to say, just because the Hetu is virus, we might call it as Agantu, but then the disease becomes Nija, and while treating, we have to treat it according to the treatment principles of both. Treatment is Chikitsaya Vishagnaiva. Immediately, you have to treat this virus, considering it's going to be virulent later. Don't give it time. And on the other hand, we have to also consider that this is going to invade. So Agantu Ranveti Nijam Vikaran, we have to understand this as Jwara, Vishama Jwara, Tivra Vegi Jwara, Bhutabhishangaja Jwara, and we have to select our Chikitsa. So at this time point, our objective of treatment is the first and foremost Samprapti Bhanga. In the beginning, our target is Ojarakshan. Before or during the whole process of treatment, till the patient comes in the rehabilitative stage, or starts getting, better and better, he starts his process towards cure, we have to consider it as Oja Rakshan is our objective. And in the later stages of disease or in the rehabilitation stage, Oja Samvardhan is our objective of treatment. So based on that, we for me, I thought of this, that because this is Jangama Vishay, it is zoonovirus, it has to be treated with Sthavara Vish based on our treatment guideline of Visha Chikitsa. So Sthavara, that is Parthiva Vish, and Parthiva Visha Dravyas are mainly Hartal, Manashila, Mercury Parad. So Malla, Somal Kalpa, Hingul Kalpa, Parad Kalpa, these are the first kalpas that come to my mind. So if we want to have antiviral action, the immediate drugs which are there are Hingul, that is Sinnabar, Tamra and Malla. So here I have written Tamra number 2, but I would prefer Malla first. So Hingul and Malla and then Tamra. That is what I have done in the treatments. After that, in the cytokine storm, that means when the dosha sammakshana is at its peak, dhatugatatva is there, the vyadhi is raktagata, then it starts going towards other mutravah srotas, shukravah srotas. So when it starts going, crossing each and every srotas barrier, then we have to think of different herbs. We know that this is landing directly into pranavah srotas. Pranavahanam srotasam hridayam mulam dashachadamanyaha. So we have to also consider hriday there. Rasavah srotas, pranavah srotas, annavah srotas, and then further. And therefore my choice of drugs was always Abrak Bhasma, Pravar Pishti, not Bhasma, and Guduchi Yashti Madhu. Because by this time, day 4, day 5, from starting of the first sign of Jwara, day 5, I could start all of this. And till then, I used Sudarshan Ghanavati, I used Tribhuvan Kirti, I also used a wonderful combination, Sudarshan Ghanavati, Tribhuvan Kirti and Shadangodak in the these first 3 to 4 days. After that, I shifted to Abrak Bhasma, Pravar Pishti, Guduchi and Yashti Madhu. Guduchi Yashti Madhu, Siddha, Dugdha. Then for Dhatu Bala maintenance, to boost this innate immunity, once you see that patient is recovering, patient is not going into breathlessness, his SpO2 is maintained at from 98 to 92, that was the range. And at that particular time point, I immediately also started some Lohakalpas. My favorite Lohakalpa here was Punarnava Mandu. I also used Yashada Bhasma, I also used Mukta Pishti here. In some patients, I have used Mukta Pishti on day 1 because they were quite clear in telling their symptoms. Adhyo Rogi Bhishag Vashyo Dnyapakaha. I could find some very Dnyapaka patients, and I'm happy about it. They called me and they said that I have just been diagnosed RT-PCR positive, and I have a lot of fear. I'm afraid what will happen to me. And in these patients, I started Mukta Pishti on day 1, a very small amount, 60 milligrams, but I did that. But after the whole process, I mean, if the patient goes through this jwara, then the oxygen, then breathlessness, he requires oxygen, he is admitted for a few days in the hospital. During that period, our medicines are continued. And then he comes back at that time point. Mukta Pishti, Shankapushpi capsules I used, and Brahmi Grita I used. Manduk Parni, in one patient I could use fresh Manduk Parni because that patient was having Manduk Parni planted at home. Otherwise it was not there. But yes, very truly Manduk Parni we can use. Apunarbhavatva and non-recurrence. Most of my patients are in this category. And here I'm using Suvarna Makshik. I'm also using Suvarna Malini Vasanta. I'm using Shilajit and Guruchi Yashti Madhu Siddha Dugdha, Brahmi Ghrita, or Saraswatarishta, depending on the Agni, Bala, and all other things. In non-pharmacological approaches, I counsel the patients very regularly. I also advise them music therapy. There is a wonderful set of meditative music from Yellowstone, and I use those 15-minute, 30-minute, 3 hours, and 8 hours sessions based on the patient's requirements. A few doctors have created their music therapy lessons. So those also I suggest to my patients. I used to send the links, and I guided them to online yoga sessions which are promoted by Ministry of Ayush. There are regular sessions going on, and most of my patients follow this advice. Why I feel now that Rasaushadhis is the first line of treatment. Very simple single quote. Alpamatropayogitvāt aruchera prasangatah kshipram arogyadayitvat aushadibhyo dikorasaha. There is nothing else but Rasaushadhis. It cuts the pathology at so quickly, and right and left I can use these formulations. So in Rasa Shastra we also get to make formulations which are Vishavat. Vishavat to whom? For a certain amount of time, yes, to our body, but definitely for the virus. It is also, virus is on the borderline of living and non-living. It doesn't have a cell wall, and therefore it's more dangerous. So it directly gets attached to the cytoplasm, replicates itself, and makes the host body its body. Now, here you need a drug which will kill whenever it kills the host cell. So when you are giving medicine, you are using Visha, which is killing your own cells, but at the same time, it is killing the virus as well. So there is no replication. And this quick action, only Rasaushadhis can give us. And that's why I always like to use Rasaushadhis. I have clearly mentioned in this slide that Durguna the target, depending on the target action, Rasaushadhis can be made and prepared. So, and can be used very effectively. They are to be used for a short period, 5 to 7 days, not more than that. So if I am using Mallasindur just for 5 days, if I am using, there is a wonderful formulation which I didn't get this time. This formulation is available from Vaidyanath. And this in Pune, the parampara of Mama Gokhale ji is to use certain combinations. So Mama Gokhale ji used this Chaturbhuja Ras, Chaturbhuja Mishran, Chaturbhuja Ras, Samir Pannag Ras, and Hemagarbha. Chaturbhuja 120 milligrams, Samir Pannag 60, and Hemagarbha just 15 milligrams. And this combination is one of the best combinations to start with just for 3 days. And this clears Jvara. It acts, I cannot say because I do not have that microbiological slide showing that this drug, kills this virus. It wipes out the virus DNA. I don't have that, so I cannot say that it kills virus. But clinically, yes, this formulation brings down the Jvara, and the patient starts recovering. The patient doesn't go from mild, moderate to severe. So that's what the drugs do. Based on the first slide which I explained to you, so approaches to explore this COVID-2 treatment using Rasaushadhis in the clinical settings are different. As I told you, patients come to us due to the fear psychosis. This is the second wave. In the first wave, Ministry of Ayush especially, they did a lot of good work. They started saying that prevention is better than cure. So there is a lot of preventive medicine available with us, and people should use it. And we came up with the guideline, we came up with the advisory, we came up with different, dietary substances, kadha, and some very good trials also started. One of the trial Ayush 64 that has been published recently. But Actually, patients started coming into Ayurvedic Vaidyas after this first wave was almost about to over. Somewhere September, October, they started coming in. And then by that time, technically also we were not much, we were not allowed, we were struggling to get permissions at the state level, whether we are allowed to treat, whether we are not allowed to treat. But by that time, because of this Disha, everybody was trained, all the Ayush doctors were trained to understand and analyze COVID-19. So the diagnosis was clear, and then we definitely started treating patients whosoever stepped into our clinics. Here I have written that in laboratory setting, experimental studies are possible only with collaboration with virology lab. So what we are doing is in clinical settings and laboratory settings, yes, people are trying. There are certain observational field studies, prospective, retrospective, some have been published, some are under the process of publication. Some other time we will take a review of all of those. But this is what is the state of treatments of COVID-19. So based on, I talked to you about the virus. I talked to you about the stages. That's interpretation is completely my own understanding. And based on that, I have put down probable leads for clinical pharmacological research using Rasaushadhis for COVID-19 management. If at all we get a virology lab, and if at all we could, come down with these 3 or 4 drugs, we can definitely test it. There are lots of issues. We need to know how our drug is going to, enter into the medium, how we are going to see the viral copies, and how the drug will be taken, how we are going to map the whole process, whether we need to do the tagging. It's a huge, huge area. So keep your fingers crossed. I don't know whether it's possible, but it's always good to imagine. It's always good to prepare. So who knows when there will be a possibility arriving stating that, okay, if you want to try your drugs, here is a lab and we are ready. So here there are points. The first point is entry point of this virus, where it gets attached to the nasal passage. Here we need prevention. The virus, when it gets attached, either through its that capsule or lipid membrane, that time point, the role is of innate immunity. Also, the role is of, the prevention barrier is always there. But in spite of this marks and everything, this is getting entered into the body. So here the role of innate immunity is there, and therefore prevention, role of rasayanas, herbal rasayanas, healthy practices, lifestyle, yoga, walk, exercise, your breathing capacity, your lung capacity is to its full. All that counts well here. So people who have not yet fallen prey to this disease, who are free of COVID-19 infection, are due to their innate immunity, which is acquired, which is which is not acquired. And rest of them who have taken the vaccine, it is due to the acquired immunity. They have not contacted COVID-19, or they have not, suffered from the disease COVID-19. The second point of intervention is the fusion process of this virus and the nasal mucosa. So here the point is destroying the protein coat or lipid membrane of the host. Now this is a spike protein. Why corona? Because there are lots of spike proteins. After that spike protein, if you have seen that figure, there is a lipid coat. So either we have to destroy the protein or we have to destroy the membrane. And at this time point, for this lipid destruction or protein coat destruction, I feel that the drugs like Mallasindur, Rasasindur, from South tradition, Navapashana Kattu, those that can be useful. Simple Tribhuvan Kirti also works well. Some of my patients who complained of just throat, sour throat and little bit mild fever, 9900. For those patients, I used the combination Sukshma Triphala with Kajali and Gandhak Rasayan. 3 times a day for 5 days, and they did not progress further. So the disease never occurred to them. So there is a, because, and Sukshma Triphala is known antiviral. It's known antiviral for rotavirus. I used that knowledge here just to try, because otherwise these drugs were handy to me. Malla Sindur was there, Rasa Sindur was also there. But then the simple drugs, nothing was there. And they were all cured. Their RT-PCR came negative. So it was all okay. These drugs can be useful. After this target fusion process, if at all you cannot restrict the virus entry at the fusion, then the virus goes to ACE2 receptor. Here, ACE2 receptor, we have to block the entry to further cells. Here, I feel that Abhragbhasma Shataputi, Vasavaleha, Vasarishta, Mrita Sanjeevani Sura, or Rasamadhavati, which is a proprietary drug prepared in Pune. These young Vaidyas, they have come up with this wonderful combination. This drug is Markava, Rungaraj based, and there are many other herbal things. It doesn't contain any of the Rasaushadhi. These can work. I don't know I cannot tell you the exact cellular level mechanism, but from Ayurvedic viewpoint, they cut the entry of the virus. Rather, they bring down the jwara. The Navina jwara, these drugs bring down. They do not allow the jwara to become jirna. And that's what they do. So clinically, they do this. Experimentally, if we can check with SC2 receptor, we would come up with, there is a possibility we would come up with a wonderful evidence. Then, at clinical level, during this mild to moderate stage, we have to use Shtungarabhraras, Swarnabhasma, Guduchi Sattva, so Dosha Bala Vriddhi, Dhatu Bala. So you have to give Baladhanam, Dosha and Dhatu. For both these, you have to give the Bala, and therefore these Balya kind of drugs which I used, Shtungarabhraras, Swarnabhasma, and Guduchi Yashti Madhu, I told you. Pippali, Shunthi, Siddha, Dugdha, also Haldi. I used to give my patients this combination at bedtime. And to my logical understanding, this combination helps inhibiting the release of IL-6 and restrict this cytokine storm, acute respiratory disease syndrome. After that, we have to also target vascular integrity, conserve the alveolar space, protect heart, protect kidneys, continue the pranabhisara, function, and therefore the drugs which work here are Mahalakshmi Vilas, Suvarnamalini Vasanta, Mrugashunga Bhasma, Prabha Panchamrut. Some Vaidyas told me that they have used Lokanath Pottali. That's not my personal experience, but they have used Lokanath Pottali Ras and it has worked good. And then for pyrexia and after post this process for rehabilitation, Suvarnamakshik, Arogyavardhini, Swarnavasanta, Punarnavashtak, Guduchadikva, Drakshadigrita, Indukantagruta. I have been using Indukantagruta in this second wave. After rehabilitation, during the rehabilitation process, I'll be using it for about 60 days in a patient. So Suvarnakalpa, I will also continue using for about 60 days in a small dose, 30 milligrams, but I'll continue using it. So this is how I have analyzed this management for me. There are some Vaidyas who, during our discussion, we come up with the post-recovery of this COVID-19 infection, admitting in not only in the hospital but also ICU. Those who have gone through this severe pneumonia with HRCT score 13, 17, 23. I have treated very recently, I have treated a patient with HRCT score 23. The day the patient informed me HRCT score was 17, I started that patient with Suvarna Malini Vasanta, Mahalakshmi Vilas, Bhratvat Chintamani, all three together. Rasa Sindur I added to that, Sahasraputi Abrak, and I gave it in Ardrak Swaras with honey. I gave 7 doses in 24 hours. Practically, the patient slept from 11:30. So the first dose went at 6:30 and the last dose went at 11:30. And during this period, I gave, I told that patient, I sent that medicine in the ICU, talked to the duty doctors and told that this medicine needs to be given to that patient. And then they were thinking of intubation. Fortunately, within that 1.5 day, we didn't have to go towards intubation. And yesterday the patient came home. That patient is on oxygen about 4 liters a day, and about 4 liters, per hour, whatever is that is the oxygen requirement. But yes, with this consistent treatment of 3 days, the oxygen dependency came down. Then we started with Yashti Madhu Guduchi Haridra Siddha Dugdha. I started with 2 teaspoons of ghee, and now at the moment also the patient is on these drugs. I am hoping that after 3 more days, oxygen requirement will still be lowered, and then I want to shift this patient on Vardhaman Pippali Rasayan with Indukanta Grita. Now this is all trial and error. Why Vardhaman Pippali? Because this was severe pneumonia. Patient is of Kapha Prakriti. Does not, there is Udara Gaurav. Because of this 20-21 days hospitalization and the whole process, there is Dhatu Bal is literally not there. So I have put the patient on complete diet. Mandapeya, Vilepi, now the patient has come to the level of Krushara. I'm giving different soups, no salads, no fruits, no nothing, because that has been told, no eggs even, but I have asked the patient to take chicken soup, considering the pranava srotas dushti, and other diet, and I'll be shifting that patient after 3 days on this Vardhaman Pippali Rasayan with Indukanta Grita. Let's see, I might have to change accordingly depending on the situations. Now, yes, why and how, why I'm showing this slide to you, when I feel that I have a good understanding of Ayurvedic basics. I have a good understanding of Nidan. I'm practicing, and I have practiced on different ethnic groups. Not only, Pune is the Sadharan Desh, but I also practiced, there were patients always from US, from Germany. I was in Hungary for 3 years, so there were patients from Hungary. Things are different. So Desha Satmya, ethnicity, everything changes. And in that, you have Ayurveda as your basic knowledge, but you should also know if there is any experimental or clinical evidence of the drugs which you are using. The form of the drug could be different, but the basic raw material is same. So you will find that the drugs which I used from the textbooks of Rasa Shastra, they have been tried and tested in the laboratories world over. So this is the first drug, zinc, Yashada. Its antiviral role against HCV virus is known, and its pathway is also known. Second drug, which again, there is another study which says that zinc complex 3. Now this formulation is different. It is not Yashad Bhasma, but zinc is there. And it is active towards viral strains HIV-1. Then there is copper, Tamra. It can disrupt the lytic cycle of coccolithovirus. So there is clear-cut evidence, not from Ayurvedic bhasmas, but from the raw materials of copper, zinc. Similarly, there is more virus. See, copper also reverse transcriptase enzyme inhibits the growth and replication of RNA tumor viruses. This works. So there is a mechanism which is known, and copper works against RNA viruses. Then arsenic is there. Arsenic oxide completely inhibited the viral multiplication in the host strain. Then silver. Respiratory syncytial virus has been completely arrested by silver. All these are experimental studies. There is no clinical study. Iron, wide range of cell pathways, including maintenance of DNA integrity, regulation of gene expression and protein translation, energy production and antiviral responses. Iron sulfur clusters are cofactors that contribute. Iron sulfur, पारदगंधक कज्जली मारित लोह भस्म, त्रिफला गोमूत्र क्वाथ शोधित लोह, and then paradgandhak kajjali marit loha bhasma. Okay, and last not the least, shilajati. It also partial virus inactivation and interference with virus attachment is the function of shilajatu, which has been recorded. So why, again coming back to my own question, why I am showing this to you? I'm showing this to you because if somebody, when from the government level they are saying that yes, there are standard protocols, Ayurvedic does not have, you do not have evidence, how can you treat? So you can show that the drugs which we are using are these: arsenic, copper, silver, iron, sulfur, and they have all shown antiviral activities. What nobody knows, modern medicine also doesn't know which drug is working. We have seen that initially it was favipiravir. We have seen that it was then the remdesivir. Then different protocols are coming. HCQ was the first drug of choice in the beginning last year February. So they are also repurposing their drug. This is called repurposing. So if they are repurposing their drugs, we can repurpose our drugs. And we are going by our Jvara Chikitsa protocol. They are going by their anti-malarial drug. Hydroxychloroquine is their anti-malarial drug. So they also started with that drug and they are repurposing it here. Similarly, here is the evidence done. All these studies are published in well-recognized, renowned, peer-reviewed index journals having high impact factors, and we are using the same raw materials with a slightly different molecule, which is rather herbo-mineral complexes, and therefore you should not, you should allow us. You cannot prohibit us from practicing using our drugs. And just for that purpose, I showed this to you. At this time point, during last 1 year, there are many trials and publications have happened. One of my colleagues, you must be knowing her, Dr. Supriya Bhalera. She's a wonderful researcher. She has published, she has presented again a month back or so, 65 Ayurvedic drugs have been registered in Clinical Trial Registry of India for the studies. So that's in Clinical Trial Registry of India. Generally, all these trials are sponsored and funded trials. So somebody needs to manufacture there is a lot of preclinical data. COVID-19 is a formulation. A trial has been published. It has been registered. Then there are 2 other drugs. Trials have been published in papers with positive results. All these results are in mild to moderate cases, and Ayurvedic drugs are adjuvants. And that's why I showed you those 2 slides. So we have to come up with confidence that yes, we might not have data on our own drugs, but we have data on their basic raw materials, which are showing antiviral activities. So there is documentation of Ayurvedic diagnosis of COVID-19. Vaidya Viren Kolle from Maharashtra, he shared a link with me, and they are doing how Ayurvedic Vaidyas are diagnosing. Exactly what? Is it Vata Kaphaja? Is it Pitta Kaphaja? It is Tridoshaja Sannipat? What exactly it is, and how the Vaidyas are looking at it. Once we get that data, it will be easier to analyze it and come to a conclusion what exactly, how we look at COVID-19. There is no need to label it any type of known jwara. We can label it as COVID-19 jwara. That is always a possibility, and we can write its, dosha dosha samurchana, we can write it sannipatatva, whether it is vidoshaja, tridoshaja, what we want to say, we can say it very clearly after we get these documents. Vaidyas like me, for example, I'm treating, I talked to you about a case very recently, which is under treatment at the moment. There are many, but mostly they are mild, moderate, or in the rehabilitation stage. This particular case, very recent case, which I could really treat in the ICU, and the patient is out without intubation. The patient's age is 30. So it was a scary situation for the whole family. Now, for such cases, I should write this case and publish it in preprint Ayur case reports by the portal run by Amrita Vishwavidyapeetham Coimbatore. Dr. P. Ram Manohar leads this initiative. Then in Journal of Case Reports, All India Institute of Ayurveda, New Delhi, we can publish such cases. Journal of Ayurveda and Integrative Medicine also supports. There are 3 papers which have been published regarding case studies and case reports. Annals of Ayurvedic Medicine also publishes the thought process of treatment of COVID-19 using Ayurvedic understanding, using Ayurvedic philosophy. So these are the places where you can publish whatever treatment you are giving. And for the Vaidyas who are young, who are trying to practice, who are dealing with these cases, who want to report their cases and contribute to the knowledge development, for them, a case report writing workshop has been planned, and you will be notified in due course of time the registration process and all the details of this case report writing. Case report is for the single case. You can very critically, you can write a report. Why publication is important? Because that gives us documentation. All these publications are peer reviewed. So 7, 8, 9 people, they, cross verify you. They ask you questions. You have to clarify everything based on the philosophy and the evidence. And then it carries validity. It has a value. We document and confirm the hypothesis. So based on this documentation, we can do further studies like which Prakriti patients are more susceptible to COVID-19. What is a generalized diagnosis for COVID-19? What is the Nidan Pancha for COVID-19 once it becomes the Nija Vyadhi? Basic diagnosis is Agantu because it is a Bhutabhishanga Jwar. Then emergence of COVID-19 Chikitsa Sutra. First do this, then do this, then do that. That kind of line of treatment that will be, generalization will be possible to a certain extent. There are a lot of people who have come up with proprietary medications. I told you about Rasamadhavati. Then there is Corich. Then in South, I forgot the name, but they have come out with the antiviral activity. They have completed laboratory tests, and they are also going ahead with the clinical trials. So there are lots of, even the coronil kit that has given, that is useful. So these type of various new formulations will come in. The evidence will increase. And also problems in adhering to Ayurvedic medicines and Ayurvedic Pathya protocols, we would be able to record those also. It's not that everything is all the time good, possible. Some patients might feel nauseatic after ghee. And for that, our texts have given us various combinations. So you can use Adrak Swaras, you can use Tulsi Swaras, you can use without ghee, but the Adrak and Tulsi Swaras is at times very pungent. Patients cannot tolerate it. Then you add ghee, they don't want it. Then you add honey, it may not go well, they feel nauseating. So there are lots of issues which come up when you start treating basically critical patients. And then all these things also will be recorded. They should be recorded. And there will be evidences of case series or case reports. If you publish, there will be these evidences, and that will contribute to taking Ayurveda in the public health system. That will contribute taking Ayurveda to platforms other than India. And that's why this is very, very important. With this, I'll come to the end of this presentation or this talk. The points which we must remember before making any tall claims, that this disease is self-limiting disease. 85% patients cure on their own. So all these medical doctors, Vaidyas, homeopaths, Siddha practitioners, all of us are dealing with remaining 15% who approach us, who need some treatment. Us means not only Ayurvedic, I mean the whole medical fraternity. Out of those 15%, only 10% need oxygen and some kind of treatment. It can be Favipiravir, Remdesivir, or Tribhuvan Kirti, or Sukshma Trifala, or Malla Sindhu, Rasa Sindhu, Chaturbhuj, whatever. These 10% recover with this treatment and oxygen supply. 5% reach to the level of post-COVID complications of pneumonia, and then heart, brain, kidney function impairment, psychosis, anxiety basically, or impairment in cognition is the right term. So these 5% severe morbid cases, they will need us. So out of 15, 10%, 5%, and out of that 5%, fatality is 1.11%. Today's, this was on April 29, just now I checked the news, they have said it 1.10. No, not much change, is the same. So when we consider these statistics, we have to understand the field of intervention for Vaidyas is at all these levels. At 15% we can contribute, 10% we can contribute, and 5% we can contribute. Also, we can contribute to the 85% where the disease is self-limiting, but there can be post recovery, during recovery issues. And those are the issues of severe weakness, those are the issues of coagulation, those are the issues of, debility, cognition, I mean, lot of fatigue, mental fatigue. So at that time point, we have a lot of scope to work. Lastly, when we understand that this is what it is, if we really want to make an impact, instead of saying that all my patients were 100%, they got cured, we have to talk very precisely that at this stage, this medication was given, the patient, showed this kind of progress, and now the patient is out of. So this practical thing, rather than wonderful results, dramatic results, miraculously the patient recovered, we should use all these terms, and we should be aware of this particular fact that 15%, 10%, and 5% is the main chunk where the whole world is concentrating and looking at. So we are also, they are looking at this 85% by giving supplements, zinc, vitamin, the multivitamins, vitamin D in particular, and also vitamin C in particular. So they are giving vitamin C, the rest of the vitamin complex, and they are treating for this debility and other things. So here we should be critical of our treatments, of their treatment, should be able to compare. I think I talked quite a lot, and I hope you understand. And I also hope that you can pose some questions to me. If we cannot take all the questions here, we will try to, I'm available on my Gmail. So you can write an email to me and we can discuss, take it further. Let me tell you, I may not be able to, I don't have ready-made answers for all your questions, but let's just start discussing. Maybe some answers are with you and not with me. That's the every possibility. So if you agree now, I will stop sharing my screen and we will look at the questions, because in the Meet app, you can't see the chat box and the presentation at the same time.
So, thank you so much, ma'am, for this wonderful presentation. It was very informative session. So, we'll move on to the discussion. So, doctors, the session is open for discussion. And ma'am, we already have few questions in the chat box. So, shall I read it out? Or, yeah. So, Dr. Gaurav Full has asked, Madam, at what time Shilajit can be used? Which kalpa of Hingula, Malla and Tamra are better to use?
Okay. Shilajit, use of Shilajit, as per Ayurvedic philosophy, we should use it in the rehabilitation phase. Once the patient is off oxygen and the patient comes home, at that time point, we can use Shilajit in Madhyam Matra, not in too high. We can use Shilajit in a dose of, not even Madhyam Matra, Madhyam Matra of Kali Yuga. We can use Shilajit in a dose of 2 to 5 grams, and that should be sufficient. For Hingul Kalpa, I have used Tribhuvan Kirti. I think Ananda Bhairav will also work, but I have not used it. I have used Tribhuvan Kirti, so I can vouch for Tribhuvan Kirti for Hingul. Malla Sindur I have used in a few patients, and that works wonderfully well. I have used it in the dose of 60 milligram, so you can use it.
Okay, ma'am. Next question is Dr. Sanjay Tiwari has asked, ma'am, what can be the prognosis of COVID based upon Prakriti?
A good question, Dr. Sanjay. Based upon Prakriti, I feel that, see, Kapha Pradhan, Vatanubandhi, they get hit, but they do not go beyond moderate. Vata Pradhan, Pittanubandhi. Pitta Pradhan, Vatanubandhi. These two Prakritis, they can enter into the severe stage. And of course, if they are also suffering from these two comorbidities, any comorbidities for that matter, if they have suffered from cancer, diabetes, blood pressure, obesity, all of this, then they really go bad. So generally, physical Prakriti, Kapha Pradhan, Pittanubandhi, Pitta Pradhan, Kaphanubandhi, these people suffer less. This is a very, very judgmental thing. It's my opinion. It does not have any research background.
Okay, ma'am. Next is Dr. Joby George has asked, ma'am, where and how do we publish our cases that we are treating?
I just gave you 4 places where you can publish your cases. One is the case registry or repository, pre-publication repository. This is that initiative of Amrita School of Ayurveda Research Center. So you can publish there. Second is JIM. You can write the case. It's a case report. Then the third is the Journal of All India Institute of Ayurveda. There you can publish your case report, and Annals of Ayurvedic Medicine. These are the 4 places where you can definitely publish your case reports. They have to be in the CARE guideline, CARE. If you go to the CCRA's website, you will find this CARE guideline. How to write this case for your presentation, that you will find there.
Okay, ma'am. Next is what are possible side effects due to use of Casualties and its management?
Fortunately or unfortunately, in past 6 months, I have not come across any of the side effects of Casualties. Probably due to the fact that whenever I'm using these Mallakalpa, Sindura Kalpa, I'm giving the patients sweet takra, Madhura takra in the afternoon lunch, and I make sure that they are taking it. Three times I am asking their, attendants, whosoever is feeding them, that are they taking that. So probably that's not there. And the doses which we are using are 60 to 120 milligram maximum. For this particular patient, I have used the dose of 60 milligrams 7 times, so 500, not more than that for 3 days. But I did not come across any side effect. Probable side effect could be daha, that is possible. Nausea, vomiting can be another side effect in these patients, but this is arbitrary and just based on the prior knowledge.
Okay, ma'am. Next is Pallavi has asked, can we give medication to asymptomatic COVID patient? If yes, then which type of kalpa to be given?
For asymptomatic COVID patients, generally Sanshamani-Vati, Yashti-Guduchi, Siddha-Ghruta, Siddha-Dugdha, that is the simplest drug which you can give. Per se, it's not even drug. It is this medicine. And in these cases also, you can prescribe Suvarna Malini Vasanta, because these asymptomatic patients do suffer from Daurbalya. The very common symptom here we found in Maharashtra is calf pain. So you have to give Punarnava Mandur. I think I shared this with you. Punarnava Mandur, Suvarna Malini Vasanta, and Sanshamani Vatti or Yashti Guduchi Siddha, any formulation. That works very well.
Okay, ma'am. Next is Dr. Ratika has asked, up to how many Rasaushadhi Dravyas according to condition we can give?
This is a bit tricky question. How many Rasadravyas? Actually, Radhika, you have put a wonderful question. This I always felt, when I sit in the clinic, I use, Mahavat Vidvas, I use Mahalakshmi Vilas with Brihatvat Chintamani. I am mixing these. I know that Brihatvat Chintamani itself consists of about 8 metal mineral drugs. Then this Mahalakshmi Vilas has another set of drugs. Do I need to mix all of them together? And when I, from this clinic, when I get up and I go into the class and I teach the drug design, I teach drug development of Ayurveda, I see that this one single drug is complete in itself. So there is no need to give another drug when I'm using Brihatvat Chintamani, when I'm using Mahalakshmi Vilas, when I'm using Suvarna Malini Vasanta. The drug is complete in itself. It works in that whole syndrome, right? I think it's my inability of that critical evidence in knowing where exactly the drug is going, how much is it going to work. So it's all, judgments part, how the patient will respond. And that's why, to be sure, I use more drugs. I'm being very honest with you. So when each of our drug, let it be Hemagarbha Pottali or let it be even the single drugs. When I teach Suvarna Makshik in the classroom, I teach Loha Bhasma in the classroom, I feel what a wonderful formulation. Each Bhasma making in itself is a complete formulation development. So the Rasavaidya will be a good Rasavaidya if he or she can treat with that single Bhasma for a disease. So how many Rasaushadhis? Based on your best clinical judgment, you can work with a single Rasaushadhi, single Vasma, or you might use the formulations. I think formulations were developed over the time period for getting better and better results, quicker results, and that's why we mix more drugs. Yeah.
Okay, ma'am. Nextly, Dr. Megha and Sanmati has asked similar questions regarding the children. Like now, the third wave is mainly causing COVID for children. So, how can we judicially use Rasaucharis and other herb for symptomatic children, and also as in the form of prevention?
Dr. Megha, I would like to inform you that I heard that Lancet Commission talk, and where Dr. Amita Kang was there. She's the top virologist of the country. And they are saying that this third wave is for children is something misinformation. I mean, it's kind of misinformation. It's going to be for all. Right now, also in the first wave, also some children were affected. In the second wave, also children are getting affected. So, and this is not going to be restricted at the third wave. There could be 4, 5, 6. Nobody knows now. So, yes, you can definitely use Rasaushadhis judiciously, not judiciary. Judiciously. Judiciously means as and when necessary, and what necessary. So only in the amount which is necessary. You can use Tribhuvan Kirti easily in the children in the small dose like 30 milligram, 60 milligram. You can use Swarna Malini Vasanta in the children. We do Suvarna Prashan. If not, you can use Suvarna Bhasma and Sahasraputi Abhrag Bhasma for sure in the doses of 15-30 milligram in children. There should be no harm. These two are very, very safe and good for the use. Give it for 7 days, wait, see, and go back. It will be a big problem for children. How to give them Guduchi, Yashti, Haridra, Siddha, Dugdha. They will not take it, they will not consume it. But we can give them Vasa syrup. We can give them Kalpa. Somebody can come up with the Kalpa, like Shatavari Kalpa. We can put all these things together and make a Kalpa for the children, and we can give them it as prevention. There can be new dosage development forms. I mean, syrups using all these herbs and drugs can be made, and then we can use these for children. That's what.
Okay, ma'am. Next, Sanmati has asked, what is your opinion regarding vaccination?
Given the present circumstances, we are the law-abiding citizens of our country. There is a lot of evidence coming from all over the globe that after vaccination, mortality, fatality, severity of the disease is controlled, and therefore we should go ahead with vaccination.
Okay, ma'am. So next is, as you said earlier, can we get your email ID for future?
Yeah, it was on my presentation in the first slide. It's very simple, wele.asmita1@gmail.com. It's my name @gmail.com.
I'll just type it in the chat box. Okay. So next is
This check, Shruti,
yes.
Wele.asmita1.
1.
You have
Okay.
to put number 1.
Okay, sorry, ma'am. I'll do it.
Amrita Hiremat, I can read your question, and it's a wonderful question. We come across many cases of young patients dying with cardiac failure. Yes, I too came across a few cases here in Pune. And I could not reach out to those patients because I heard that after they were no more. So that's why the moment we understand the patient is diagnosed with RT-PCR and it's positive, we should start with some Hridya Dravyas. The most important is Dugdha and Ghruta. These are rasayanas, ojavardhan dravyas, also rudya. And therefore, for me, Guduchi Shatavari Yashti Ashwagandha can be the best Kshirapak made using Guduchi Shatavari Yashti and Ashwagandha. That will prevent cardiac arrests as well. That is what I feel. And Abhrag Bhasma. Nagarjuna Abhraras, Shungara Abhraras, these are very good these are very good rasayanas which are Rudya. Also, uh, if the patient is going from mild to moderate, immediately start Mahalakshmi Vila. That was the reason I think I use Mahalakshmi Vilas in these patients, because prana, I explained, na, pranamah srotasanam moolam rudayam. Pranavanam srotasam rudayam moolam dashacha dhammanya. So you have to consider lungs as well as heart. And in the side effects or in severe COVID diseases, you will find kidney impairment. The patients, they're getting discharged. They show tremors. They cannot balance themselves. That's the sign of kidney impairment, and it's being missed. So here we have to also consider kidney. We have to add gokshur. So rasayan churna with addition of ashwagandha is also a wonderful option, and we can use that. Some of the ghrutas, Indukanta ghruta, Drakshadi ghruta, which are rasayana category, those are very nice. And once the moderate patient does not, does not enter into the further phase, which is the wonderful thing to have, we can ask all these patients to take these rasayan churnas, Trifala rasayan with Drakshadi ghruta or Chavanprash, one of the best rasayanas, which will also act on Hriday with Ghruta, and then ask the patient to increase their intake of milk by adding anything. That's how.
Okay, ma'am. So next is...
Somebody is asking about Gandhadruti in mucormycosis, how it is used for Nasya. I am sorry, I cannot give you this answer because I have never used Gandhadruti for Nasya. I tried application of Gandhadruti once on myself, that too for the uvular pain a little bit, just a little. It's very burning, it's painful. So I don't know how to give it in Nasya.
Okay, ma'am. So
should we stop here?
Yeah. So let me call Naveen sir or Rahul sir to conclude this session.
Hello, madam. Hello, everyone. I am extremely delighted to be here with Dr. Asmita Wele, madam, to hear such a wise presentation. It is packed with the clinical wisdom. And for the first time, I am seeing a presentation where the modern pathological stations are correctly joined to Ayurvedic treatment methodologies. So, this gives a clear idea to us youngsters that if we can work out properly, having good clinical idea or good clinical backup regarding the medications which are present in the textbooks, we can rightly correlate it to particular clinical stations so that the patient is benefited quickly and maximum effectively. So, madam, we request you to be with us in this venture. We are having a bunch of doctors, especially youngsters, who are with us. We have started our operations in Bangalore, and we are going to launch the teleconsultation services at Delhi too. And all our services, except medicine, is free of cost from the doctor's part. And we request you to be a help for us, because sometimes we need real help from persons like you to manage extreme cases. And I am a person myself, Dr. Naveen, and the anchor Dr. Sri. We three are people, and we are having more experience using supplements. Whereas when you gave guidelines regarding the proper stage-wise application of the solution, many of us who are not so conversant with the series got benefited. And actually, for us, this lecture became a platform to learn more. We are going back with some good takeaways, madam. So I once again thank Dr. Asmita Wele madam, Prof. madam, to be with us for coming for us with such a power-packed presentation, enriched with wisdom. Thank you, madam. Thank you once again. And I request Dr. Naveen Chandran to have his concluding remarks.
Thank you, Dr. Rahul, for your kind words. It was good that I could say what I wanted to say. Yeah.
Thank you, madam, for in this late moment. I am not taking more time of yours. Anyway, for me also, it was very clear from your presentation how we can see a presentation from a presenter who is a teacher, a practitioner, as well as a researcher. So it was quite like a combination of all these three. Thank you, madam. And all of you who have been a part of this session, thank you all, our dear doctors. And for all of you, have a nice evening. Good night. Thank you.
Thank you for inviting me, and I hope you all continue your good work. And I would participate whenever it is needed. Thanks a lot.
So thank you so much, ma'am, and thank you so much all the doctors for joining us. Thank you, everyone. With this,